Welcome to this online training for educators working with Chester Medical School for the Year 2 curriculum starting September 2025. My name's Nicola Connolly. I'm the Clinical Year 2 lead, and over this next presentation I'll be outlining some details about the Year 2 curriculum and the clinical placements that the students will undertake in their second year of the postgraduate MB-CHB course. As you can see from this diagram, the students have 3 9-week core clinical education blocks during their second year. These are interspersed with academic blocks that they spend at the university. And each of the core clinical education blocks includes a medicine block, a surgery block, and a community and specialty block. The Year 2 curriculum starts at the end of the first year of the course, where the students have a transition block. They also undertake a student-selected component and an audit in second year, which is done within their GP placement. The aim of the second year curriculum is to increase the amount of time that students spend learning in healthcare settings. So by the end of the year, the students find themselves immersed in community and hospital-based settings. As mentioned in the previous slides, the Chester Medical School curriculum follows a case-based learning approach. There are 12 case-based learning cases that are undertaken throughout the year. The themes of the academic blocks covered in the year include the following topics: cardiovascular health, child health and pregnancy, cancer and palliative care, women's health, infectious disease, endocrine, long-term health conditions and mental health, autoimmune and rheumatology, and substance misuse. Furthermore, throughout the year, the students will come back to the university for central teaching days known as theme days. The topics listed in this slide are some of those theme days. As mentioned, the teaching follows a case-based learning format with integration of vertical themes, including sociology, pharmacy, medical ethics and law, and also personal professional development. A significant proportion of the lectures in the academic block in second year are delivered by clinicians and offer a clinical perspective. Students in their second year will undertake placement with 4 main local educator providers, including Countess of Chester Hospital, Warrington Hospital, Robert Jones and Agnes Hunt Hospital, and within the Betsy Cadwallader Trust, made up by Wrexham and Glenclwyd. There will also be some placements in a community setting, including a range of private independent voluntary organisations. 2 key documents to support the students during their clinical placements in second year include the Year 2 Placement Handbook and the Year 2 Logbook. The handbook outlines the learning objectives for the second year placements and provides students with a wealth of information about the types of activities they'll undertake whilst on placement and the expectations from the medical school for students while they're out on placement. The logbook in particular details the clinical skills and procedures that students will need to undertake in each core clinical education block. Here are some of the medicine and surgery learning outcomes which are embedded within the handbook, which will be made available to you as a clinical or an educational supervisor. As you can see, the learning outcomes are based on common core clinical presentations within each of medicine, surgery and community and specialty. The students have already undertaken training in history and examination for core specialty subjects in their first year, and the second year of the degree focuses on extending and applying this knowledge and skills in terms of being able to take a history, perform an examination, formulate an investigation and management plan for these core clinical conditions. Here are the specialty and community learning outcomes for the second year. Other key documents and programmes for you to be aware of as a supervisor. Firstly is the undergraduate medicine e-portfolio. The training for this is in a separate video, and you can have bespoke one-to-one further training for using this as an educational supervisor to complete assessments and arrange meetings with the trainees you're supervising. Also, as a clinical supervisor, you are welcome to undertake training in order to familiarise yourself with completing assessments for students. Within the logbook and within the clinical placement requirement document, which will be shared with you, there will also be clear guidance about the number of assessments that students will undertake in each of the blocks. As you can see here, as a rough guide, for every 9-week block within the hospital setting, we ask for 1 OSLA, 1 mini-KECS and 1 CBD. There should also be an initial supervisor meeting, an end of placement supervisor meeting. A midpoint meeting is optional but recommended if any concerns are raised. The student is also expected to engage in reflective practice on the portfolio during each block. Clinical skills and procedures sign-off in the second year of the course is at the level of competency outlined by the GMC as SIM level sign-off. For medicine, surgery, community and specialty, we ask for all the clinical skills and procedures listed in the logbook to be signed off at SIM level, both whilst on placement and also when taught centrally within the university. The reason for asking this is to ensure that there are no gaps in the delivery of teaching for clinical skills and procedures, and because all of these skills and procedures can be tested in the OSCE examinations at the end of the year. Further guidance regarding this is also outlined in the clinical placement requirement document. The community and specialty 9-week blocks will be undertaken at the Countess of Chester and the Robert Jones and Agnes Hunt Hospital. These placements include 3-week rolling rotas within community and specialty, each at Countess, and a 3-week specialty block at Robert Jones and Agnes Hunt Hospital. The reason for the more complex model of this timetable is to ensure that students get a wide variety of clinical experience, including specialist surgical experience, orthopaedics, paediatrics, antenatal postnatal care, laboratory and investigation experience. There's also opportunity to undertake mental health placements, sexual health clinic visits are organised, and home visits with our community older adult team. The assessment format in Year 2 is as follows. As you can see, a large number of the assessment process is formative as we introduce students to the UMET portfolio. However, it is essential that students engage with this process, as without demonstrating an engagement with the portfolio, they cannot pass their professionalism assessment for the year. You can also see the students undertake 2 summative written papers and an OSCE at the end of the year. And just to show you at the end of this presentation the current diagrams for the 3rd and 4th year of the MBCHB course, to give you an idea of the structure of the course in the years to come, which will be outlined at following presentations. Thank you.